Hello and welcome to another MistedForest presentation. I did a research paper and presentation in my last graduate program talking about stigma that still happens today in the medical field, and it also happens in the education field and the work field. So folks with ADHD get stigmatized and harassed all the time. It still happens. Although there's more awareness now, there's still not a lot of understanding of what ADHD is, and I'm here to help you unpack all of this. And it is Halloween today, so I felt like it made sense. I feel like a unicorn. I've noticed many folks with ADHD tend to feel like a unicorn, both in that they are very different and have different needs, and also that folks don't really get them. So, what exactly is ADHD? A lot of different health conditions can look like ADHD, and there is a lot of comorbidity, meaning multiple diagnoses or multiple health and mental health conditions that someone with ADHD can have. Let's unpack that. What most people think ADHD is: trouble focusing, fidgeting. Maybe they think about the medication that's prescribed. It's often associated with disobedience, young children, especially boys. But that's just the tip of the iceberg. So, what ADHD actually is: difficulty maintaining relationships, often depression. The impulsivity causes financial problems, hyperfixation, so intense focus on things that the person finds interesting because you get that dopamine hit, and then very difficult ability to concentrate on things that are not interesting in the moment. Rejection sensitivity dysphoria. It's not in the DSM, but it's basically being rejected over and over again since a young age creates this sensitivity and defensiveness. And so folks with ADHD are very likely to get emotional wounds from rejection or difficulty with feeling rejected. Choice paralysis. This happens to everyone, I think, but for folks with ADHD, it happens a lot more. So basically, part of that is because of short-term memory. Folks with ADHD, you can imagine it, have only a couple short-term memory slots, where the average person probably has two or three more. And then folks that have really large short-term memories, think of waitresses that can remember everything. We have the smallest amount of short-term memory. So if, say, a teacher or an employer gives directions and they give more than, say, three, by the time number 4 or 5, I've now forgot one because I can only hold so many objects in my mind at a time. Some folks with ADHD have really good long-term memory to compensate. I'm one of those people. I have very above average, actually in the high percentile. I did cognitive testing recently for long-term memory. So, you know, having ADHD doesn't mean that you are useless, which is a stereotype a lot of people have. Just like with everyone and everything in life, we find ways to compensate. And also, something to note: sleep issues are seen with people with anxiety, depression, sleep apnea. There's so many conditions that have sleep issues, but that is one of the symptoms. You can learn more from here. And then also, there's different types of ADHD, and I feel that in the future, considering how many folks with autism have ADHD, I've seen research that says 25% of folks with autism have ADHD, and then I've seen research that says people with ADHD or have a 50% chance of autism. So I personally feel that more research needs to be done. Anyways, don't want to go on too many tangents. So there's three types. There's inattentive, hyperactive, and then combined. Folks who get diagnosed early in life usually are hyperactive. Um, Folks who are diagnosed later, or girls AFAB, assigned female at birth, tend to be more on the inattentive side. And combined type, an example of that would be thoughts are hyperactive, so more thoughts are faster thinking, but maybe it's not as obvious on the outside. And there's also something here to say about trauma. Uh, Intense trauma while the child's in the wound or early in life can cause a lot of inattentive and hyperactive expressions, and that's valid. ADHD tends to be overdiagnosed in African American young males. So there is something to be said about trauma and like the environment someone is living in. It is completely natural to have skipping attention also, say with folks who've had sexual abuse at a young age, like dissociation. So even if you have an ADHD diagnosis, it may not be the answer, or maybe it's only a part of the answer, and I want to validate that. I've had ADHD since I was young, and there was definitely things in my childhood that affected it. But even as I've gotten a lot healthier and wiser and more mature, I still, a lot of things are still there. So that makes me think that I have the the type of brain that's how my brain developed. Um, and I have a beautiful, lovely brain, and there's nothing wrong with it. So there's that. Okay. You're probably wondering, when are we going to get to the stigma? That's what's next. So most people don't know all the information we just talked about. And here's some insults and stereotypes that I asked the ADHD community. These are real quotes from real adults with ADHD that people have said to them. You can't have ADHD. You're too smart. If you just applied yourself, then you would really be something. Stimulant medications are drugs. You shouldn't take them. Isn't there a natural way to cure your ADHD? I know a lot of people have cured their ADHD. If you can focus on if you can focus so much on drawing, you should be able to put the same amount into your schoolwork. You're weird, stupid, lazy, inconsiderate, loud, annoying, inconsistent, emotional, bipolar, childish. You're trying to use your ADHD as an excuse for, I don't have ADHD. You're just a little lazy. I don't want to prescribe stimulants. They're addictive. And I will just read one more. You can pause the video if you'd like to read the ones I haven't. I was going in for depression, which I think now stemmed from not treating ADHD. And my doctor said, "You look like you take showers and can hold a conversation. Why don't you just quit drinking diet soda and get a job? It should get better." Amazing, doc. Glad you spent all that time in med school. It really paid off. I think this video of the little boy holding themselves is pretty accurate to how I felt as a child a lot. Just really overstimulated. I didn't start doing well in school until high school, and that's probably because the other kids around me weren't yelling and running around, and so I actually could concentrate, and I didn't have to spend so much time self-regulating. So it's it's already hard enough. And imagine the additional hate and pain of just all those insults and criticisms and people not believing in you over and over again for your whole life. How do you think that would make you feel? So I'm hoping if you're watching this as a friend, as a medical professional, as a future or current therapist, nurse, I really want you to consider the amount of pain and suffering that your patients, your clients, your friends are like what they're going through. And the last thing you need to say is all the awful things that people have already said to us. I kind of already went over this a little bit. I just want to talk a little bit about hyperfocus. So this happens with folks with autism as well, but the reason for it's a little different. So with hyperfocus for ADHD, the current theory is there's not enough dopamine in the brain, possibly norepinephrine as well. And so when we're doing things that are motivating, it's because we're producing those neurochemicals. There's also other feelings too. And when we do something exciting, if you don't have enough already of dopamine and norepinephrine, you are going to want to just keep doing that activity and you can't stop. And then another reason you might not be able to stop is because if you do, then you'll get distracted. Whereas with autism, the reason you might not be able to stop is because it's almost problem solving. It's like an itch you have to scratch. Um, and there isn't necessarily a distraction component. However, if someone is dual diagnosed or maybe identifies as both, then they could have both experiences. I personally am only diagnosed with ADHD. There's a very high chance I am also on the ASD spectrum, but as an adult, there's really no point in me getting evaluated because there really isn't any help. Um, and I've noticed that for me, my special interests, for example, interior design, it can make life really distracting. I'm in a co-working space that I'm paying for right now because my need to be in a quiet, clean, secure environment is really high. And most environments to study are just too distracting. They're not safe. Like someone could steal my laptop. Maybe the bathroom's not close enough by. So that's related to another medical thing. Um, and then if the space is chaotic looking, coming back to the hyperfixation, there's that the like the almost autistic side is like, I need to fix this. I need to problem solve. I need to fix it. And then almost the ADHD side is saying, this is distracting. I'm so distracted. Um, so that's just an example and like the difference. And it can be really intense. So with the the hyperfixation, like I've practically peed myself because I'm so focused or won't eat for like 10 hours. So it really is something that it's important to work with an ADHD coach or a medical professional and in being in community so we can improve those habits. So the main presentations of ADHD are inattentiveness, like distractibility, daydreaming, being unorganized, losing things, difficulty listening, so getting distracted in your own thoughts or around things around you. For hyperactivity, this can be obvious with behaviors like tics or stims, like shaking, tapping, rocking. Um, Difficulty sitting still, so sometimes we'll rush through tasks just to get it done. There's a whole emotional component about that. How to ADHD, she has a great video about The Wall of Awful. I recommend checking it out. Making rash decisions. So if you're combined type or impulsive type with a hyperactivity, rash decisions could be spending way too much money you don't have, going on dates with people who are probably dangerous, um, working on something that's not due right now. Um, you can start to see how that could easily make it so people with ADHD are more susceptible for relationship abuse or substance abuse, and there is a high correlation. And I'll continue on with that. So, folks with ADHD, what does that look like in the brain? So, the areas that are affected are listed here, and executive functioning is mostly the frontal lobe, and that's, planning, time management, concept and experience of time. It is also organizing, decision making, reward delay. So there's that famous experiment with the marshmallows and seeing if the kids could wait to eat the marshmallow, and if they did, they get another one. Um, there's a lot going on, and stuff that's not necessarily talked about that's starting to come into the forefront where trauma can be involved as well is the regulation piece. So the amygdala can be overactive, so a fear or fight flight response could be overactive. Yeah. Oh, of course. And memory. Why didn't I mention that? So memory is really affected, and especially short-term memory. So I really like this quote by Mueller. The combination of stigma associated with ADHD can be conceptualized as an underestimated risk factor affecting treatment adherence, treatment efficacy, symptom aggregation, life satisfaction, and mental well-being of individuals affected by ADHD. Public as well as health professionals' concepts about ADHD are highly diverse, setting individuals with ADHD diagnosis at a greater risk to get stigmatized. Those with physical or invisible disabilities, especially undiagnosed ADHD, are 300. I'm going to say that again. 300 times more likely to be in an abusive or codependent relationship, abuse addictive substances, go to jail, die, yes, die by accident due to impulsivity or risk-seeking behavior, or commit suicide. Dr. Hallowell. Dr. Hallowell has a great book, ADHD 2.0. I recommend reading it. Thus, the average adult lifespan with ADHD is 13 years shorter. 13 years shorter. And we're not including comorbid conditions that can happen very easily, like substance use disorder or diabetes. Yeah, it's sad. And that's why we need to take this more seriously. We need to take adults with ADHD way more seriously. This is like people can die if they're not treated, if they don't get help. I can't even tell you how many times I almost died from, like, I was really into like intense hiking and some extreme sports, just being stupid. Um, yeah. I was also an adolescent, so you combine the two, and it's a recipe for high risk. And so I also want to mention here that the barrier to treatment is even worse for non-white or Caucasian. Here in the United States, we like to divide people by a skin color, which is awful. I know not every country is as racist as the United States, but a lot of the research is here in the United States, and folks who are basically not light-skinned European Anglo-Saxon looking of descent, and folks who don't speak English, and folks who are not US citizen. So folks who are not US citizens, folks with dark skin, folks who don't speak English have so many additional barriers than their light-skinned Caucasian-looking counterparts to get treatment for their ADHD. And then there's also a higher chance of comorbid trauma and institutionalized racism and all these other awful things that they have to deal with on top of it. And I just want to say a little thing about depression. Depression is really common for folks with undiagnosed ADHD. And I think by now from this presentation, it's self-explanatory. If you're told over and over again you're a failure and you do keep failing, you don't know why, and you're trying so hard, it's really hard not to develop, negative thinking patterns and lifestyle patterns and behavioral patterns that lead to depression. So that was all some heavy stuff. Let's talk about some treatments. I'm going to talk about holistic and lifestyle changes as well as medical and prescription based. I think it's important for folks to use whatever works. I am not anti-medication. Neither am I medication is the only answer. Okay? The ADHD diagnosis is life-changing for adults to discover. You've spent your whole life wrestling this invisible opponent. You had no idea what was sabotaging you, or even it's been there, undermining you your whole life 24/7. You just assumed life is this hard for everyone. Rick Green. And then this quote is from someone on my Discord server. I just feel like there would be so much more. I just feel like there would be so much more of an uphill battle with my own brain if I hadn't been diagnosed a decade or two later. What incorrect beliefs would I have solidified about myself, you know? So she was diagnosed early in life, and she's talking about and recognizing how much worse it would have been had she not gotten diagnosed early and gotten treatment. And she's in Canada, so she got treated better than I did here in the United States. And I grew up in California, so I just, yeah. All right, treatments. So right now, the most effective treatment available that most doctors might know about is stimulant medication. The research about giving stimulant medication to someone at a young age is conflicting. There's a lot of reasons for that. But here's the thing. If it for sure is ADHD, your child's risk of killing themselves or getting hurt or hurting someone else because of impulsivity and risk-taking behavior, not to mention not being able to concentrate in school and then the risk of dropping out, don't you think that's a lot worse? I just want you to think about that for a second. Also, Ritalin or methylphenidate is not street meth, okay? There's a difference, a huge difference. One is dosage, way lower. Two is how it is processed by the body. Three is how much is released at a time. And often ADHD medications like Vyvanse, for example, have norepinephrine reuptake inhibitors as well. So there's like plenty of videos and articles you can read about different medications. So I'm not going to go too into it. Yeah, but just have an open mind about it. And just one more thing about medication. There's the Ritalin family and the Adderall family. They work differently. And so if you're working with your doctor and you've tried a couple on one side and it's just not quite working, it's better to go switch to the other side. And what might have worked for you in childhood may not work for you in adulthood. And there's dietary factors that affect it, like, are you eating with your medication? Are you fasting? How much caffeine are you drinking? So really work with your doctor to figure all of that out. It takes time. I don't know too many people that like right away on the first med they got it right. And that's also similar for other medications like SSRIs, serotonin reuptake inhibitors. Nice thing about stimulant medications though is you notice within like that day whether it's working well or not, where other medications have to build up in your body. All right, ADHD coaching. Pills don't train skills. Repeat it with me. Pills don't train skills. So just because you take the medication, which is like putting glasses for your brain, great. Now you can see. Now what? Right? That's what the coaching does. And you can hire a private coach. There's one I really like that I work with on and off a lot. Maybe your school has some integrative coaches you can work with. And there's also communities like Ada or Chad. And that can be helpful if you don't have a lot of money to just be in support groups and maybe take some workshops. And then, of course, therapy. I'm getting trained as an art therapist. I think creative therapies are really great for folks with ADHD since we naturally are creative people. And there's dance therapy, there's narrative therapy, focusing on the conversations and ideas we have about ourselves, right? And they use writing techniques. There's a lot. Cognitive therapy or cognitive behavioral therapy can be really good if you also have depression or anxiety to interrupt your thinking and behavioral habits. I think that's really helpful, but and most folks with ADHD, especially if they got diagnosed late in life, have a lot of trauma to deal with, and CBT or CT aren't going to deal with that. So sometimes you might have to like work with one therapist doing one type of thing and then after so much time switch to another one, or if you're able to afford more than one kind. All right. Here's some stuff that Dr. Howell had mentioned, and it's frustrating to me that neurofeedback, for example, is not covered by insurance. Apparently the research, it's you know, in the book The Body Keeps the Score, which is about trauma, neurofeedback is talked about a lot. I've personally done neurofeedback. It's incredible. It doesn't work for everyone, but basically, like, electrodes are put in your brain. The technician reads your brain waves, and then based on your symptoms that you're expressing and what they see, they send electrical impulses and help you balance out your brain. Electrical activity. I've seen pretty big results. There was a time I was so debilitated by my comorbid conditions, I couldn't work at all. And after 10 sessions, I was able to handle a part-time job. So that's money well spent for me. Something that's not on here is transcranial magnetic stimulation, which is for FDA approved for depression. Some places will do anxiety. There is still clinical trials going on for anxiety, PTSD, and ADHD. But if you have depression as well as ADHD, I definitely recommend transcranial magnetic stimulation. It is non-medication. It uses same technology as an MRI machine, and it sends magnetic pulses. It's pretty intense, and it takes a long. It's about 3 months. Uh, I am shocked how big it made a huge difference in my anxiety and depression, which of course helped me improve my chronic fatigue syndrome. It was a piece of the puzzle on that, and it didn't really help my ADHD, but having a big reduction in anxiety and depression just improved my quality of life. So that's something. I did mention somatic therapies. So the ones I didn't mention are EMDR, which what researchers think makes EMDR work is the bilateral movements that your eyes do when you sleep, and we process our day in our sleep. So that's the theory of why they think it works. We do still need more research. It's really popular. It's one of those things that got popular, but then they kind of stopped doing research because it got popular, but there's still not a lot showing why it works exactly. I've done EMDR for trauma, and it's helped a lot. I've heard people say it helped their ADHD, which could mean that their ADHD was actually trauma based and not ADHD. Um, and then I already mentioned CBT, but DBT, dialectical behavioral therapy, can be good if you might have comorbidity with ADHD and bipolar, or if you have a personality disorder, or DID can help with like regulating your nervous system and learning skills. Any therapies that use mindfulness is great because folks with ADHD can really get in their head. And then we have the cerebellum training. So like fine motor skills. And you can improve your cerebellum and grow it with balance training. So I'm a yoga teacher, and I was a dancer for a long time. Turns out that playing sports, throwing balls, catching balls, ice skating, spinning, doing all this movement, training my balance, training my hand-eye coordination, all of that really made it so I was able to function a lot better than folks who didn't go through that. And there are balance centers you can go to where they progressively make your balance training harder and harder and harder. And for people who live in countries where they can't get medication, this is something that has been shown to be effective in really reducing the negative symptoms of ADHD. So I'd say give it a try. It's definitely worth it. And meditation. I have some videos on YouTube on how to meditate if you have ADHD. There are ways to do it. And I can't stress mindfulness and meditation enough. It really helps to improve your sustained focus. And that is something a lot of folks struggle with. Some other things: swimming, full body contact. I started swimming again. I used to be a competitive swimmer. There's very few activities where your entire body is being touched and submerged, and that also can be really good for folks with sensory issues or autism. A trampoline, bouncing, and I mentioned spinning. So things where the full body is getting movement is really, really good as a treatment or additional therapy. And then here are some of my recommendations to use with clients. And you can just pause the video and go ahead and read. And here are some of my resources. If you have any questions, please comment below. and I'll try my best to get back to you as soon as I can. I really appreciate you watching this presentation. I know it's a longer one, so have a lovely day, and if you're watching this on Halloween, have a lovely Halloween. Keep being your sparkly, magical, beautiful selves, and I'll see you next time. Bye!